The value of the close-on approach is that it makes it more comfortable for the client in that they don't have to undress to receive a treatment. It takes care of boundary issues. It takes care of gender differences. It takes care of so many things in a clinical setting. It allows us to do our assessment procedures. It allows us to ask the client to stand up, walk around the table, and assess the progress of what you've been doing. It allows us to use the sideline position, which has proven all important in delivering high-quality clinical treatment. I've spoken with so many experienced massage therapists whose bodies are wearing out. Their thumbs, their hands are not able to deliver the quality of treatment that they would like. And I have an answer for them. The utilization of a close-on approach, incorporating the sideline position, incorporating a tool like this thumb saver, has proven to extend the career of so many massage therapists. So I say to you, save your thumbs and extend your career by incorporating the close-on and sideline approach into your practice.